Okay. You can pull your chair over here if you like to, and you can sit down. Yeah. Don't want to stand.
We have a whole slew more tomorrow, okay?
Okay.
That's why I was.
Good afternoon. My name is Megan Owens, and today I will be presenting to y'all the information I found over heart attacks versus panic attacks over this semester. You can pull up a chair if you want. It's going to be a little bit long. Okay. So just a little bit of background information. Over the past semester, my mentor has been Miss Courtney, and she's on the right in the picture. She's a family practice nurse at Friends with Family Medicine. When Miss Courtney was out, Miss Denise, who's on the left, was also my co-mentor, and she's a family practice nurse. When I was here and being mentored, I visited with patients of all ages, and I would help take vitals, which includes taking body temperature, weight, and blood pressure and heart rate, and also collect important information like what medicines they're allergic to, and if they're on certain medicines or they got off them. So just a couple of things. So I took vitals, and these are a couple of pictures that show how I did it. So on the left, this is one of my mentors, and I'm taking her body temperature. So it is an ear thermometer. You first put a little plastic cap on it just for sanitary purposes, and then you stick it in the ear, make sure it's in the canal or it won't get an accurate body temperature reading. And then on the right, I am taking her blood pressure. So you put the blood pressure cuff on the patient, strap it on, make sure the screen is facing towards them, and then press the button and they put it towards their chest. And then once it's done buzzing, you take it off and it'll have the systolic and diastolic blood pressure and also their pulse. So an introduction for heart attacks. So heart attacks happen when plaque builds up in the arteries, and there's too much plaque buildup. It will lead to the narrowing of the arteries, and it makes it harder for blood to flow through. And this plaque is arterial plaque, and it's basically hardened cholesterol buildup. And when it becomes too narrow, the pressure builds up, and this plaque can rupture if there's too much pressure, and this lead to a clot to be forming, and this would be called coronary thrombosis. And once this clot forms, it forms a dam in the artery and basically prevents any blood from coming through, and this will cause muscle tissue to die. So factors that increase your risk for having heart attacks. So there are genetic dispositions. So this means that there's a history of heart disease in the family. This can include coronary artery disease, which is a condition where the major blood vessels that supply the heart narrow. You can have arrhythmias, which means that you have an irregular heartbeat. You can have congenital heart disease, which means that you have structural defects in the heart when you're developing as a baby or a fetus, which can include a hole in the heart. And you can have cardiomyopathy, which is a disease which makes it difficult to pump blood throughout parts of the body. You also have risk factors that make you more likely to have a heart attack, which includes drug use, cigarette smoking, high cholesterol, high blood pressure, diabetes, alcohol use, eating disorders, and a sedentary lifestyle. So sedentary lifestyle means that you are not eating properly and you're not exercising enough, so you're not taking care of your body, and that can cause stress on the heart. So now that I introduced heart attacks, this is an introduction for panic attacks. So panic attacks happen due to heightened anxiety. They can be spontaneous or caused by a stressful event, such as presenting the science in a presentation. Anyone can have a panic attack, but if you continually have anxiety, this could be a trademark symptom of panic disorder. Panic disorder is diagnosed in people who are consistently engrossed in the fear of having panic attacks or have had a history of them. So factors that increase the risk for panic attacks. There is no genetic predisposition yet, so there's no anxiety gene in the body, but instead of like having genetics run in the family, it's passed on. Anxious behavior is what is usually it's mistaken by. So actually they found that there could be possible problems with neurotransmitters in the brain that could be causing these problems for anxiety attacks, but they haven't found a specific part in the brain that's causing it. Basically, an anxious temperament and anxiety-related personality traits predisposed or to having these panic attacks. And environment and behavior play a pivotal role. So having an anxious temperament or personality, this is a phenotype, which is a set of characteristics that are of an individual that is affected by the genotype, or yeah. So these problems with the neurotransmitters, some of them include, so SAMe, excuse me if I pronounce these wrong, but it's S-adenosyl L-methionine, and you need melafolate, vitamin B12, and protein to create it in the body, and it is a naturally occurring molecule that helps with activation and breakdown of chemicals in the body, like neurotransmitters. And if you don't have enough of this, you could have a problem. So, another neurotransmitter problems that could happen, the GAD enzyme catalyzes glutamate, which is a neurotransmitter, and creates the common GABA neurotransmitters. So you don't have enough of these enzymes. This could cause you to be tense, and that can lead to having a panic attack.
What's wrong with cocoa?
It's true. No, I'm just kidding. You need magnesium and vitamin B6 to create this enzyme, and if you don't have enough of it, that could cause problems. Also, the COMT enzyme, if it inactivates dopamine, and if you have too many of these, then you will not have enough dopamine in the body. Dopamine is a neurotransmitter that creates pleasure and happiness, so if you don't have enough of that, you kind of will be depressed all the time, and therefore can lead to having a panic attack. Also, causes for panic attacks, you could have a situational cause, which is like a riding in a car. You could have a lifestyle cause, which means like environmental factors or family history. So if you had abuse in the family, and that can cause having panic attacks. And also smoking excess caffeine. So smoking, it restricts the lungs because of the tar buildup, and having trouble breathing is a symptom for having a panic attack. And then excess caffeine makes your heart beat really fast all the time, your heart rate's up, and this is also a symptom for having a panic attack, so it can lead to it. So now, between the two, when you're having these symptoms, do you have overlapping symptoms? And a lot of people blame it on stress, even though they might have a heart attack. These overlapping symptoms include chest pain, vomiting, loss of consciousness, trouble breathing, and the length or duration of the symptoms. Now, even though they have overlapping symptoms, they do have differences. So some physiological symptoms for heart attacks is an escalating pain that reaches severity after a couple of minutes, and it feels like someone's sitting on your chest. And the pain radiates throughout your neck, your chest, and your arm. And you'll have shortness of breath, and you'll have the prickly feeling, which usually happens on your left side of your body just because your heart's over on the left side. And you can also have sweat, nausea, and intense cold. For panic attacks, physiological symptoms, you'll have increased heart rate, and you'll have a sharp pain, but for a short time, unlike a heart attack. And the pain is localized to one small area, it doesn't radiate. The pain occurs at rest, and it's accompanied with anxiety, and pain is relieved or worsened when you change body positions. For psychological symptoms, mostly are just for panic attacks, and these include a sense of impending doom or danger, a fear of loss of control or death, a feeling of unreality of detachment from the world, an intense fear that you'll have another panic attack. You can possibly have suicidal ideation, and a feeling that you're choking. Now, with heart attacks, psychological symptoms might be a possible anxiety or stress a couple of days before, but really most of them are just for panic attacks. So why to still go to the hospital? Even though there's clear distinctions, psychological and physiological, they're still hard to differentiate just because these symptoms can vary and mimic one another. Panic attacks, worst case scenario, can lead to the person feeling that they're having a really bad heart attack. So when in doubt, call 911 and seek medical advice, just because you want to find the best treatment for yourself and ensure that you have a healthy and happy life. So my plan, originally through research and looking up articles at the middle of the semester, I wanted to find a better way to figure out how to differentiate the two, the heart attacks and panic attacks, on your own, so you didn't have to seek medical advice. But I found out that there's not really a good way to differentiate because you need to take tests, which only happen at the doctor's office. And everyone had said, every doctor and medical provider had suggested to seek help. So instead of focusing on the main difference by yourself, I want to focus on education, control, and prevention. And by doing so, this would be by teaming up with insurance companies. So currently, there's the ACA, or Affordable Care Act, allows for Obamacare, and that would be free insurance for only a select couple of people. So people who don't make enough money aren't applicable to it, and people who make too much for it. So instead of just having that, it would be for all insurance companies, and they would, for their patients or customers, have 1-0 copay annual wellness checkup that they would give. Also, I work with employers. All employers had to have health care for their employees, and they would have to schedule a time during the workday for them to go to that wellness checkup. Also, the employers can give a gift card or bonus as an incentive. They would do this just because if they have enough of their employees going to their wellness checkup, they can get a health care refund. The reason for this plan, so even though this is the best way to go to the doctors to see what you have, a lot of people have excuses not to go. So many people, like out of 500 men aged 18 to 70 in the US, 3 out of 5 men don't go or go to their annual checkup. So that means 2 out of 5 men aren't going to the doctor basically at all. 40% only go when the problem is severe and prevalent, so that means if their foot's kind of hanging off, maybe they'll go. 53% says health isn't a discussion they have, but it's really important to discuss your health because if you want to stay alive, that's kind of what you need to discuss. And also 19% go to stop their significant others from nagging them, so shout out to those people. Also, some more research, about 1,300 participants, they had some excuses on not going to the doctors, and it's in my handout. They'll have plenty of excuses. 33% have unfavorable evaluations, like they don't trust the doctor, they perceive discrimination, they fear the bad news, they don't want to wait, and they don't want to be around other people that are sick. 12.2% had low perception to seek medical care, like 4% said that their problem goes away over time, and 58.4% have traditional barriers such as high cost, time restraints, and no health insurance. Now, even though they have plenty of excuses not to go, these aren't relevant. So if the doctor breaks your trust or discriminates you, this will break the HIPAA law, and basically what happens, HIPAA is a law enacted that makes sure that as a patient, your information is kept confidential with the doctors. And also with insurance and companies giving a free schedule out of the workday wellness checkup, this gets rid of the health insurance problem, the cost problem, and the time problem. Also, people complain that they don't want to be around sick people, but they have patient waiting rooms. And also, people don't want to know, they fear the bad news, but hate to break it to you, but you're still going to have it no matter what. And it's better that someone tells you what is wrong, because they could find a treatment for it, because like I said, a checkup can potentially save your life. So what doctors can do to track these heart attacks, they can do multiple things. One thing including is a test. So they can take a nuclear stress test, which is imaging with radioactive material to see how well blood flows through the heart. You can take an EKG or an electrocardiogram test, which means you attach lead patches to the body and check the electrical activity of the heart, which is a non-invasive way. They also have a treadmill test, which means that a doctor will check and see how well your heart is running before you get on a treadmill, and then when you're on the treadmill, and see if there's any problems. You can also take an echocardiography, a nuclear perfusion study, or a magnetic resonance imaging, or MRI, to see whether a flow-limiting blockage is present. Also, the picture on the right is a nuclear stress test. So A shows that the blood is flowing through perfectly, or pretty well, and then B shows that there's a flow-limiting blockage present, because the yellow part isn't all the way across. They can also check for heart rhythm, so if they use a stethoscope and see if there's any arrhythmias, because that would be a condition that could lead to a heart attack. They can also take your heart rate, which means this is the number of times your heart beats in a minute. And if you have a high pulse all the time, this could lead to hypertrophy, which means that your heart's doing overtime to the point where they're having to add extra cells on the heart, and this can cause other problems in the body. They can also check blood pressure, which means that the blood pressure is the force of your blood on your arteries when your heart is pumping the blood. So a normal blood pressure for an adult at rest is less than 120 over 180. And there are examples of the categories of blood pressure in the packet. And years of high blood pressure can stiffen and narrow the arteries in the walls, which blocks off the blood flow and can lead to heart disease or heart attack. So I said 120 over 80 is a normal blood pressure for a person at rest. So the top number, 120, is a systolic blood pressure, and this is the pressure in your arteries when the heart is contracted. And then diastolic, which is the 80 number, is the pressure in your heart when the heart is relaxed. And this is just the time where the in-between heartbeats. They can also take blood tests. So one of the main things they check is your LDL cholesterol and HDL. So your LDL cholesterol is the bad one. It has a low density lipoprotein that is highly associated with coronary heart disease. And the HDL, which is the good one, is a high density lipoprotein that is not as associated with coronary heart disease. They can also check levels of sodium, potassium, albumin, and creatine. If you have abnormal levels of these could lead to signs of heart failure. Also, the doctors will check and tell the patients to just have a healthy diet. So if you eat too much red meat, it could cause problems. So you want to eat more lean meats like white meats. Avoid as much dairy and just have a balanced diet. So after talking about what doctors do to track heart attacks, they can also track panic attacks. So you come and just talk to your doctor about how you're feeling. You can describe your symptoms. They also give a little physical test. They also give a not so secret depression test where they can see if you meet the requirements for anxiety. And they can prescribe medication to help this. So the two most common ones are antidepressants and anti-anxiety meds. So an example of an antidepressant is a selective serotonin reuptake inhibitor, or an SSRI. This is an antidepressant that inhibits the absorption of serotonin by the neurons, which increases the availability of the serotonin in the body. An example of this is Prozac. And then an example of anti-anxiety med is benzodiazepine. This is a medication that acts on the GABA receptors. They attach to these receptors and make the nerves in the brain less sensitive, which gives a calming effect. And this example of that is Xanax. So just some personal experience. Why I chose this is that heart attacks and panic attacks are happening more frequently in this day and age, just because we're such a high-paced world, and I wanted to delve in and see more information about it. So just myself, I've had bad anxiety myself, and I wanted to see what the solutions were for them. And my Nini, who's my grandma, she recently had a lot of chest pain, and she just blamed it on stress. She had a high position in her job for a while, but when she went to the cardiologist, she found out that 2 of her arteries are almost completely blocked off, and that she needed to have a stent put in. Also, my dad, we just have a heart condition that runs through the family, so my dad has to check on his cholesterol levels, and he actually just had a test recently, found out he has high levels of HDL and LDL cholesterol, so we need to balance his diet out more, take a little bit less dairy out, and we do eat a lot of red meat, so he's going to try to eat more white meats, like turkey and chicken. In conclusion, I've enjoyed my experience at Friends with Family Medicine and cannot wait for more experiences to learn. This past semester has been amazing. I started out with little to no information on nursing. I knew that I might want to do it, people had suggested it, but with this and just learning about the day-to-day life of everything, it's been an eye-awakener, and I really cannot wait to study nursing as a major. Thank you to Miss Courtney, my mentor, for the opportunity given me to see the daily life of a nurse, and allowed me to experience it myself by taking the vitals and working with the patients. And thank you to my teacher, Coach Penders, who has graciously answered my thousands of questions, and everyone in the office who has answered my questions and worked with me, because I know I can be slightly difficult. But in my portfolio, which you have in front of you, Ms. Courtney, I had information in there. I included my 14 weeks of the log sheets that I've come here, and they have detailed information about what I experienced with the patients and information that I collected from all y'all. And then I included pictures and explanations of what I've done and just some causes and effects of heart attacks and panic attacks, and some more information that explains more about my presentation. But anyways, since this is concluding my presentation, is there any questions? Yay. Oh yeah, and this is the work site. Thank you.